Hello, dear listeners. In the previous video, we looked at the algorithm of first aid for a person without consciousness and breathing, talked about proper action, and conducted CPR to maintain vital functions of the body until the ambulance arrives. Today we will discuss how to provide first aid to the victim in the absence of consciousness and breathing when there is an automatic external defibrillator, and learn how to use it safely. What is an automatic external defibrillator? AED is a device that delivers a controlled electrical discharge in order to restart the heart. It is important to know the AED is your assistant and, in a sense, the leader of your actions. It will tell you what to do and will produce an electric discharge. However, it will never replace your actions. Therefore, if there is an AED nearby, be sure to use it within performing CPR. And remember, the early start defibrillation within 3-5 minutes from the development of the cardiac arrest allows the victim to survive in 50–70% of cases. Of course, it is not always possible to use the AED. So if there is no one around, you must follow the CPR action that we examined in the last video. Traditionally, the AED is located in public places, shopping centers, airports, schools. A common international sign indicates its location. It is a green square with a white cross in the right upper corner, a heart and lightning. When you see this sign, that means that there is an automatic external defibrillator. So let's recall the CPR algorithm and include the use of AED. In the last video, we said that when you find the victim and approach him, first you need to check the safety for yourself, the victim, and eyewitnesses. If nothing threatens you, approach the victim, kneel down, gently shake his shoulders, and ask loudly in both ears, "Are you all right? Do you need help?" thereby assessing consciousness. If the victim responds, leave him in the same position. Find out what happened to him. Regularly evaluate his condition, breathing, and consciousness. If the victim does not respond, check the breathing. The breath test is determined by tilting the head and lifting the chin. To do this, place one palm of the victim's forehead, grab his lower jaw with 2 fingers of your other hand, and carefully tilt the head back. Inspect the oral cavity for foreign objects. Next, bring your ear closer to the victim's lips, observe the chest excursion with your eyes, and count it loud to 10. Again, there are 3 principles. Watch for movements of the chest, listen, breathing in at the victim's mouth, feel the breath of your ear and cheek. If within 10 seconds you have not found breathing and there is someone near you, ask the assistant to bring AED and call an ambulance, following the calling algorithm. The assistant rushes for the AED and calls for an ambulance. At the same time, you start CPR, having released the chest from clothes. As soon as the assistant brings the AED, turn it on. The assistant puts electrodes on the shirtless chest of the victim while you are continuing the CPR. Teamwork is essential here so as not to interfere with each other. It is often indicated how to place the electrodes on the victim's chest properly, right on the packaging or on the electrodes themselves. The correct location of the electrodes on the chest is crucial and associated with the anatomical and physiological characteristics of the heart. The first electrode must be placed below the left armpit, stepping back the palm. Place the second electrode under the right clavicle, to the right of the sternum, and then follow the defibrillator's prompts. After applying electrodes, the device will analyze the heart rhythm. During the heart rhythm analysis, do not touch the victim and make sure that no one around reaches him. If the device has counted the rhythm and the application of the discharge is shown, shout, "Step aside, everyone," and visually check that no one is touching the victim. Press the discharge button as instructed. After discharge, if a cardiac activity has not been restored, immediately begin CPR under the voice commands of the device at a rate of 30–2. Cardiopulmonary resuscitation must be continued for 2 minutes. Then the defibrillator will begin the rhythm analysis again, and so every 2 minutes. Do not stop CPR until your AED tells you to do this, the victim shows signs of life, begins to breathe, move, opens his eyes, makes noises. You are too exhausted physically. In terms of AED use, important to pay attention to the wet chest. In some cases, the chest will be wet due to profuse sweating or after salvation from the water. it is necessary to drain the breast before applying the AED electrodes quickly. The next is excessive chest hair. In some cases, an excessively hairy chest can cause problems with the application of AED electrodes. In such situation, it is necessary to shave or cut the hair to ensure good contact of the electrodes with the skin. There is no need to shave the chest in all the victims. This is a waste of time. Watch the stickers. Remove any stickers or other material placed on the victim's chest to ensure that AED electrodes are in a good contact with the skin. In some patients, there can be medical patches on the chest. They must be removed as they can cause sparking or even burns during defibrillation. Remove any metal jewelry that might come in contact with the AED electrodes. Place the electrodes away from jewelry that cannot be removed, such as piercings. Some victims may have implantable pacemakers. They are usually visible under the skin, under the collarbone. Sometimes they are located under the right clavicle instead of the left. Make sure that the AED electrodes are not placed on or near the pacemaker. To sum up, today you learned the algorithm of first aid with the use of an automatic external defibrillator for the victims in the absence of consciousness and breathing. To consolidate the material, watch a video and see how the right action in case of sudden cardiac arrest will look.
Are you okay? Do you need help? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Call an ambulance and bring me the AED.
'76 Karl Marx Street. One man about 40 years old, unconscious, without breathing, starting CPR using AED.
10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9,
Open pads
30.
package and apply pads to patient's bare chest.
1, 2,
Press
3,
pads
4,
firmly to
5,
patient's bare
6,
chest.
7, 8, 9, 10. 1, 2, 3, 4, 5,
Analyzing
6,
heart
7, 8.
Stay clear, everybody.
Do not touch the patient. Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Press the orange button.
Shock.
Shock delivered.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7.